We're now joined by State Representative Christina Sappey. She's a Democrat representing a district in Chester County. Thank you for joining me.
Thank you so much for having me.
Now, you're sponsoring a bill, HB 2454, that deals with telemedicine. What would that do?
Well, right now, telemedicine is being used in Pennsylvania, but this would actually expand access to telemedicine for all Pennsylvanians, and it would include coverage, equal to that for COVID expenses, as office visits. It would also include children enrolled in the CHIP program. So any of those visits, they could now have telemedicine for, and mental health expenses as well would be covered by telemedicine. So it's a very important thing that we need to get done in Pennsylvania. It really does expand healthcare access to all Pennsylvanians.
So you mentioned that we currently do have telemedicine as an option, but obviously with this bill, this deals with things that are not covered under the previous legislation. So what are some of the limitations under the current law?
Right now, we have telemedicine in Pennsylvania, but it's not available everywhere, and it's not covered frequently by insurers at with comparable to office visits. And office visits are not always possible. Pennsylvania is a huge state, and we have a lot of rural area. I think that's actually one of the best things about Pennsylvania. But this would definitely increase our capacity, for people to see a provider and to have it covered.
So you mentioned the Children's Health Insurance Program. So the current bill doesn't allow reimbursement underneath that measure.
House Bill 2454 would include CHIP, but the original bill did not, and that's a huge omission. We need to make sure children have access to, all forms of healthcare.
So with the coronavirus, obviously we've been staying at home, and there have been shutdown orders. How has telemedicine fared under that circumstance?
It's definitely being utilized more, and this is it's highlighted the need for this. It's here, and it's not going anywhere. It's here to stay. So we definitely want to make sure that providers, are properly licensed, and that we understand what they're providing, and that it's covered by insurance. So that's I think what we're seeing now is sort of illustrated that this is something that we can do to increase access.
Does the current law limit the types of medicine or types of medical assessments that can be done through telemedicine?
Not to my knowledge, but there are, I shouldn't say not to my knowledge, but mental health, I think, is something that is not covered across the board. And again, the children's expense, people who are enrolled in CHIP are not covered, and people in Medicaid also are not covered.
Now, there was another bill that was working its way through the General Assembly addressing this issue, Senate Bill 857. How is your bill different from that one?
Well, that bill was actually, our bill is very similar to that bill, and that bill had great, wide support in the medical community and in the insurance community. But that bill unfortunately was amended and, had restrictions put on some medications, FDA medications, that are on what's called the REMS list, which is the Risk Evaluation Mitigation System. And it's a long list of medications. And so when you restrict that, you're restricting people's access to healthcare for a wide variety of healthcare issues, addiction, you name it. We have a lot of medications on this list. And, we really don't want to lock Pennsylvania in time that way. We really need to make sure that people have access to the medications and the treatment they need when they need it.
I'm sorry, go ahead.
And that it's covered. We want to make sure it's covered.
Are there opponents to telemedicine?
I have not heard of any. I think people are using it now. They like it. Again, talking to our rural communities, we have a lot of rural area in my district, and it's increasing access. People, have to travel long distances to get to a provider. It takes them a long time to get an appointment. It makes, we are experiencing wait times, and that's not in the best interest of our health. our overall health. We want people to see their provider as quickly as possible and as efficiently as possible. And, there are people with, their own businesses and their own agricultural operations that can't take a day off to travel to go see a provider. So this provides, them the access that they need to get good, solid health care.
Now, in order to take advantage of telemedicine, people would need to have access to the internet, especially something like high-speed internet. That's another issue that policymakers have been trying to deal with. What are you seeing in the legislature? Is there a corresponding effort to encourage or
I'm
provide?
not sure it's actually a corresponding effort, but there's definitely movement on getting broadband access throughout the Commonwealth, and I think it's definitely needed. And there's also an opportunity here for us to create applications for people to use telemedicine, with their cell phones, and for folks who don't have that internet access, to increase access to internet and broadband in a rural community, but also to create applications, on any type of device to access this telemedicine.
Now, at this point in Pennsylvania's dealing with the COVID-19 crisis, most of the state has opened up to the green phase, or has entered the green phase of reopening. Where's your district in that?
We went green about a week and a half ago, and we were one of the last counties to go green, so it was a long wait. It was, and it was challenging, but we're doing well so far.
How has coronavirus affected your district over the past few months?
We've had, we're in the Southeast, so we've had a lot of coronavirus here, a lot of positive cases. Unfortunately, in my district, we did have one nursing home that had, a high number of fatalities, unfortunately, but we've really been working to address that in the legislature and making sure that our providers and our, workers have what they need to stay safe in these facilities. But, a lot of the impact was there, but the impact has also been on our small business community. Unfortunately, they've really taken a hit with this. So we were anxious to go to green to, get businesses back open and running, and to get people, back out.
What have you been hearing from your constituents about how Pennsylvania has been handling the crisis?
People are very happy with the way we've handled this. In my district, I have heard far more positive feedback than negative overall. People take this very seriously in my district. They understand. A lot of them actually work in the healthcare industry and understand how serious this virus is. And that there's a very good chance that we're going to see a second wave later this fall. So people are trying very hard to plan for that, but they are also, they're very hesitant to just resume life as normal. So I applaud the people in the 158th for the way they've stood up and done what was asked of them. It's been hard. It's definitely been challenging.
State Representative Christina Sappey, a Democrat representing a district in Chester County. Thank you for speaking with me.
Thanks again for having me.
PCN Profiles gives you a candid look inside the lives and careers of notable Pennsylvanians. Hear personal stories from leaders of business, politics, science, sports, and the arts in their own words. PCN Profiles airs Sunday nights at 8:30. PCN, Pennsylvania History and Culture.
Sarah Boateng is Executive Deputy Secretary at the Pennsylvania Department of Health. Thank you for joining me.
Hi, I'm glad to be here.
Now, the Department of Health has recently rolled out a COVID-19 early warning monitoring system dashboard. What does that do?
Yeah, so the department has a number of dashboards available. We have the COVID dashboard, which provides the comprehensive overview of COVID-19 and its impact here in Pennsylvania. It shows a statewide impact, county by county impact, an age breakdown, demographic breakdown, and all of that's available on our website, healthpa.gov. Just last week, we released the early warning dashboard. This dashboard looks at 6 specific metrics that we're monitoring as the state reopens to ensure that we at the Pennsylvania Department of Health, but also the public, understands what is going on across the state and by county. This looks at case incidence over the past 7 days, if that's increasing or decreasing. It looks at PCR positivity rates. PCR is the lab test that an individual would get if they had or suspected COVID-19. So we looked at how many positive cases we have in those lab tests compared to the global number of lab tests we're doing. It also looks at things like hospitalizations of COVID-19 patients, ER visits with individuals who have COVID-19-like illnesses, and ventilator usage here in Pennsylvania.
How often is the information updated?
We update that information on the early warning dashboard each Friday. It is a 7-day look back, so that weekly updating accounts, it allows for some smoothing out of the data over the course of the week and can really provide an up and down picture on if a county is progressing down or up in terms of cases or hospitalization rates.
Is it designed for just Pennsylvanians in general, or did it have the idea of maybe small businesses or county governments?
Yeah, we wanted to put it out on our website to make it available to anyone. We use the data here at the department as we're looking at the impact of COVID-19 across the state. But we did arrange it by counties so that county commissioners, local electeds could look at the impact in their specific area. Small business owners could look at it, and the general public could look at it. Should they want to just understand what's going on in their community.
Now, on July 1st, Secretary Levine signed a mask-wearing order. Why was that necessary?
There's nothing that Pennsylvanians can do more to protect themselves and protect their community from COVID-19 than wear a mask. The Secretary signed the order requiring Pennsylvanians to wear a mask anytime that they leave their house. And it's critically important for us to take care of ourselves and our community by wearing the mask. Wearing a mask is a public health step. It's not a political statement or a partisan issue. It is a really important and yet simple step that individuals can take to protect themselves and their community.
Now, there has been some resistance to wearing masks. What can the Department of Health do to persuade people to wear them?
The Department of Health strongly supports individuals wearing a mask. And a mask can look like many things. Some people wear, I have a cloth mask with flowers that suits me. Some individuals might wear a bandana or fashion a mask out of a favorite t-shirt following instructions that we have online. You can also use a face shield, which is an alternative for individuals who might be speaking on the phone for long periods of time and not want something covering their mouth during those conversations. So it's most important that individuals wear a mask. And as I said before, it's not a political statement to wear a mask. It is a public health step that folks can take to take care of themselves and, most importantly, take care of their neighbors in their community. My mask protects you and your mask protects me.
Since it is an order to wear a mask, what types of things can the state government do to enforce that?
We here at the Pennsylvania Department of Health, we work with our sister agencies like the Department of Agriculture, Pennsylvania State Police, the entities that have regulatory authority over different businesses, and we are enforcing the masking order through those relationships. We do have a complaint form on our website that the public can complete should they have concerns about something they perceive to be unsafe in their community, like someone consistently not wearing a mask or a business not enforcing the mask order.
Now, over the past few weeks, counties around the state have been transitioning to the green phase. How is that process going?
The entire state of Pennsylvania is in a reopening stage or in the green phase. The governor and the secretary took a very measured and iterative step to that reopening, using data to drive the decision making. We opened slowly across the Commonwealth and monitored. The monitoring dashboard is an example of that, the cases as we went through that reopening. What we're seeing is that as a result of that reopening, there is some increased case counts, particularly in Southwest Pennsylvania, mostly surrounding Allegheny County. And so the Pennsylvania Department of Health is working very closely with the Allegheny County Department of Health, Dr. Deb Boateng, their health commissioner, to monitor the situation there and take any mitigation steps necessary.
Now, as people are watching very carefully to see if there's a resurgence of infections, and we've seen them in Arizona and Florida and Texas, is it possible in the future that if we see that, counties could go back to a yellow or even a red phase?
We're not looking to send counties back to yellow or red. We're really looking to learn from what we experienced in the spring and then apply those lessons to through the summer and then here into the fall. So again, the most important things that individuals can do is to wear the mask, social distance, stay home if they're sick, seek out a COVID-19 test if they have concerns of their symptoms or they have been in close contact with someone who is a positive case. We have a number of testing sites now available across the Commonwealth. And then we're working with local leaders like Dr. Deb Boateng, who I mentioned before, to understand the impact of COVID-19 in their community and then take targeted mitigation steps, for example, in Allegheny County, where they closed bars and restaurants to in-house dining.
Now, one of the things that goes along with reopening is testing capability. You just mentioned it there a moment ago. What's our state of the testing capability right now?
Pennsylvania has done a tremendous job of increasing the testing availability here in the Commonwealth. So Pennsylvanians should visit health.pa.gov. They can look at a testing map where they can put in their zip code and find a location where that they can get a test. Many of these tests are drive-up opportunities at pharmacies like CVS, Rite Aid, Walmart, as well as at healthcare facilities like hospitals and urgent care places. We originally set a testing goal of 2% of our population per month. We are exceeding that goal. So just yesterday, there was over 16,000 test results that came in. And so we're really continuing to see an increasing tests over the past month, and we're now up to over 14,000 tests on average coming in a day.
Sarah Boateng, Executive Deputy Secretary at the Pennsylvania Department of Health. Thank you for speaking with me.
Travel with PCN across the state as we capture Pennsylvania's rich history and diverse culture. Journey back in time as we tour the state's many battlefields, listen to the stories of veterans, and hear insights from authors on the past. Explore agriculture with coverage of the farm show, or take a behind-the-scenes tour of how everyday items are made right in your community. Watch Pennsylvania's past and present come to life on PCN. PCN, proud to bring Pennsylvania history and culture to you.
Dr. Kristin Sznajder is an assistant professor of public health sciences at Penn State College of Medicine. Thank you for joining me.
Oh, thank you so much for having me.
So at this point in July, some states have started to reopen and see some surges again in coronavirus. Where are we? Give us an assessment of where we are right now.
Well, as you mentioned, we do have increasing cases in this country, so we're not in a great place right now. We've seen in the last 2 weeks cases across the U.S. nearly double the daily case count. So certainly people need to continue to take precaution as they enter public spaces, because we're still in the middle of a pandemic, and although we've been in one for a while, we still really are in one.
So when we look at trends over the past few months, have there been periods where it's increased and then decreased and then increased again in a way that is significant for an epidemiologist?
Well, I would say we still are in the first wave, so we haven't hit any other waves at this moment. We're still in the first waves. We have seen surges. Some of them are as states and locations start to reopen, and people may feel less cautious in terms of going out in public and social distancing and wearing masks, which are all still important behaviors that everyone should be adhering to in order to stay safe and keep their neighbors, families, friends safe.
Now, we've had public health crises before with things like Ebola and H1N1 and the flu, something that comes through regularly. Is coronavirus following the same pattern, or is it doing something unique?
Frankly, I think we're still very new into this disease, so it's really hard to know, but we definitely do see waves in those other viruses that you mentioned, but there is the possibility that we won't see waves here. We may just see continuous viral spread because we don't necessarily know all the disease dynamics right now with coronavirus, as we're still learning much more about how the disease works and how it's spread.
Now, one of the projects that you're working on with your colleagues is a registry of pregnant women with COVID-19. Can you talk a little bit about that project?
Certainly, yes. We're very interested in learning about how COVID-19 can affect pregnant women and their newborns. So we do have a study going on now at Penn State where we're looking into this. We are enrolling women into the study so we can learn about psychosocial factors that are affecting women currently in the pandemic, as that's becoming more and more prominent due to changes in our lifestyles and things that are going on with the pandemic. Certainly, we're also very interested in how the virus could be impacting delivery outcomes, complications at delivery, or before with pregnancy and newborn health. Recently, the CDC has indicated that pregnant women are at a higher risk for severe outcomes of COVID-19, whereas before we weren't so sure. So data are coming out to indicate that pregnant women may have more severe illness compared with non-pregnant women. And our study is looking within pregnant women what may be going on with their health in terms of, are they at a higher risk for preterm birth or low birth weight or other adverse outcomes that may potentially be due to exposure to being infected with SARS-CoV-2 or having COVID-19 disease.
How many people are you looking for to participate in this program?
We're hoping to get about 400 or 500 women.
And what is involved once they're accepted into the program? What do you do?
Oh, yeah, that's a great question. Thanks for asking. So this is a longitudinal cohort study. So right now we're asking women to enroll during their pregnancy at any point in their pregnancy. So it could be 39 weeks or it could be 4 weeks. And then they would get a monthly survey, and then they will at delivery. They'll have a monthly survey, and then at the end of the study, they'll have a postpartum survey. So we're just working on that now. We're hoping to get more and more information from women. We would then be linking their survey data to their electronic medical records. So we would have information on some of the possible complications that would happen at birth or throughout their pregnancy. And these data would really help us better understand how the virus can affect pregnancy and newborn health.
Now, is there anything that pregnant women can do differently than what the rest of the population is doing to protect themselves?
Well, the important things are really social distancing or physical distancing, wearing masks, staying outside if you do plan to interact, restricting time with others, and avoiding crowds, washing hands. Those are all the same things that everyone should really be doing. For pregnant women specifically, it's very important to continue their care, prenatal care, because prenatal care is known to help prevent or to improve the care of pregnancy. So that's very important that they don't miss their prenatal care appointments.
To go back to coronavirus just in general, at what point did epidemiologists realize that this was going to be a pandemic?
Well, I think people started to get nervous in around January when we started seeing cases in China, in Wuhan. We were learning more and more about the news reports there, and it started to really make us concerned that this could be something that may spread outside of a localized area.
Is there anything that's really stood out for you over the past few months that maybe was a surprise that you didn't expect to see?
In terms of viral spread, or
in terms of the coronavirus, its nature, its characteristics.
I think we're just keeping it, we have this learner's perspective. I mean, it's a new disease. So things like the way that it affects vasculature and how there may be more long-term effects of the disease too. So these are kind of findings that we may, that I didn't really expect, but I'm not sure they were surprising because we're still really learning about everything. So there could be many more effects of the disease that we will learn later as well.
Now, in Pennsylvania, most of the counties have moved into the green phase, and people are starting to resume some of the activities that they had not been performing for a few months at least. As an epidemiologist, what types of things are you keeping an eye out for, just as perhaps warning signs that it may be returning?
I think people need to be avoiding crowds, needing to be avoiding crowded spaces, staying away from indoor locations as much as possible, wearing a mask, staying cautious. So just because we're opening up, it really doesn't mean that the virus is gone. And in fact, it's increasing in most areas of our state and of the country. So we really need to be maintaining caution. And although it's great to be able to go out again and go to restaurants, it's important to remain cautious and to continue physical distancing, wearing masks, washing hands, avoiding crowds. So if I see a big crowd of people without a mask on, I probably would be a little worried.
Well, let's talk a little bit more about masks. It's become kind of a contentious issue in terms of mask wearing and having the state order mask wearing. How effective is the mask in preventing the spread of the virus?
Yeah, it seems to be very effective. So in light of the evidence that has come across in the last few months, we really do realize that wearing masks both protects you and protects others. So wearing a mask is for your own protection, but also it really does protect the other people that may come in contact with you from any droplets that you may be expelling that could contain the virus. And while people are asymptomatic, it is important to wear a mask even if you don't feel sick or if you don't have symptoms, because you still may have the virus and just not know.
Well, Dr. Kristin Sznajder from Penn State College of Medicine, thank you for talking with me.
Oh, thank you very much for having me.